IV is now in.
Yeah,
so
it's definitely better than.
All right, you guys, so welcome back to my YouTube channel. It's your girl, Riii. It is just a very chill day, and I was kind of thinking that I wanted to show y'all how to do some very common nursing skills. So 2 of those things are gonna be how to start an IV, and number 2 is gonna be how to spike a bag of IV fluids. So if that's something that you do, nurses or healthcare professionals or people that are interested in my world, if that's something that y'all want to see, then stay tuned for more, and I will show y'all soon. All right, so first let's get into all of the supplies that you're going to need to start an IV successfully. So it's going to be kind of like 2 skills in one. So let's just start with how to start an IV.
Are you about to do that now?
So So first you're gonna need an IV start kit. So this inside of here comes with cleaning solution, so that, it comes with cleaning solution so you can start by cleaning. It comes with a tourniquet, some tape, gauze, and an IV dressing, which is all that you need. So next you're gonna also need an IV. So there's different IV sizes. 20 gauge is the pink. It's honestly like the most common. It'll get most of the fluids throughout the speed that you need. A 22 gauge is smaller, but you can't push fluids as fast. And then an 18 gauge would be bigger. So it goes, this is gonna be a regular IV. So it goes like 18 gauge is the biggest, 20 gauge is in the middle, 24 gauge is a super tiny catheter. And so I'll show y'all. This is an adapter piece also, so I'll show y'all, but basically you're gonna connect your adapter in your saline. You're gonna use this, pop in the IV, connect this, and then just put the dressing on top. And then this is the tubing that you need for your IV fluids, and I'll show y'all how do you get this set up too. All right, y'all, so do not mind. Actually, let me see if I can adjust really quick. All right, so y'all already know as nurses, number 1 is improvisation and just making things work. So obviously I don't have an IV pole and things like that here with me. So I just found like this little tall thing, and I'm just gonna use this to be an IV pole, and I'm gonna show you guys how to use spike a bag of IV fluids. Basically, when I say spike a bag of IV fluids, I just mean connecting the IV tubing to the bag of fluids without any bubbles in it, and just making sure that it's set up to administer to the patient. So let me show you guys. Obviously, step number 1 is hand hygiene and making sure you put on gloves. So you have your bag of IV fluids. I'm gonna go ahead and open this up. So you have your fluids. These come in different sizes. They have 250 milliliter bags. This one right here is a full 1 liter, 1,000 milliliters of fluids. And this is the IV tubing. This is honestly like pretty standard. I've seen this at all the hospitals that I've worked at up until this point. So you just tear it open. Here's all the tubing. As you can see, it might look like a lot. Just so you can kind of see, this is the part when you say you're gonna spike it. It's like a spike and you stick into the IV bag. As you can see, it's a long tube to let all of the fluids go through. Something that you have up here is this lock. So before you spike the fluids, I just open the tubing. My first step that I'm gonna do is make sure that I lock this. So now it's locked. Number 2, I like to go ahead and just take off all of these extra pieces. So you can go ahead and take this off. You can go ahead and take this off. All right, and now you're set. Main important thing is making sure that this is going to go into somebody's body, so you just wanna make sure that you're staying clean. So keep the tips on things like this until you're actually ready to connect it to your patient. So next thing that we're gonna do is grab our bag of IV fluids. You can do this however you would like, but I personally take it, flip the bag over, pull this off. Now you see my spike. I'm going to push it in. Hold on, let me show you guys. Just like that. Push it in a little bit. So now as you can see, this is now attached to the fluid. So the next step that you're gonna do is to squeeze this. Now we have to prime the line. Priming the line, just making sure that you get fluid from the bag all the way to the end of this tubing before you give it to your patient. So let's go ahead and do this. As you can see, the vial, it now fills up with water. And then I'm gonna show you guys, I'm gonna go ahead and undo. Remember when we locked this at the beginning? So that's the reason that the fluid is not flowing. You can know that the fluid is not going because you don't see any drips dropping into this chamber. They call this a chamber, and it'll start dripping. So pay close attention and I'll show you. So you see now it's dripping. So now it's going down the tube. Do you see it moving? So now it's all the way down, and then watch, it'll start dripping out through the end. So that means now we have primed our line. So you see it dripping? That means that now it's going all the way through the line. It started up here, went all the way through the chamber, and then now it's like this. Obviously, something like this is set up to where it would go through an IV pump, but in some cases you don't have access to an IV pump, and so the way that you would control how fast or how slow that this is dripping into somebody would be through this chamber right here, okay? So that is how you spike a bag of IV fluids, and then next I'm gonna show you guys how do you actually start an IV, and then that'll kind of wrap up what we're doing, so hang tight. But yes, just so that everybody knows, do not just be randomly practicing things like this at home. It is specifically for nurses, nursing students, phlebotomists, people that are within the healthcare profession that have received adequate training. And then these are just practice tools to help you, build upon your foundation. So we have to go get our patient. So let's go get her. What? So. Are you ready for your IV? All right, you guys, so we are about to start. Yep, this is my testing dummy. And then we also are gonna have somebody come and record also for TikTok. So let me go ahead and set this up. I kind of want to set it up so they can see. All right, y'all, so we're about to get ready. I'm recording.
Hi, YouTube.
Hey, look, this is my Aunt Madeline.
Ignore that part.
Yeah, she has good veins. So we'll look, the first step is gonna be to look and see what the best option for your patient is. So I'm just gonna open up this IV start kit. I already showed y'all what it all has in it. And the first step to starting an IV is going to be putting on the tourniquet and looking for the best IV access. Some of the things that you're looking for is gonna be if you can see the vein, making sure that you can feel it. One good tip that I had heard, it kind of feels like a sponge. When you push down on it, that's how you know you have like a really good one. All right, let's see. But as you can see on this candidate here, you already see her veins, which are great. I personally love the hand IVs. Some people say that they hurt a little bit, but I personally hate AC IVs. The ones that go right here are my least favorite just because when patients bend, it's gonna make the alarms go off constantly. So I personally like the forearm or either the hand, and for this, we're gonna use the hand. My patient doesn't like hand IVs, so just, reassure them and let them know everything's gonna be okay. It's gonna be a tight squeeze. Okay. It's okay. All right, so then you just let their hands go. As you can see, it's gonna make the veins start popping out. Perfect. And sometimes too, y'all, when people have really good veins like that too, sometimes they can blow. Like when you put it in, you have to make sure you have the right size catheter because sometimes they can't blow. What? So you have your IV dressing right here. We're gonna start with using some cleaning solution. Always make sure you have your tape ready. So I just go ahead and peel it. So I don't really have to. All right, so first things first, we're gonna clean. So you just squeeze this little thing together. The solution comes out. Me personally, I just go all over the hand, just to make sure that you're not introducing any bacteria or germs. What patient? You can ask the patient, do you have any questions? Are you okay? Next, you have to set up for your adapter because you need to let this dry. So I'm gonna go ahead and let her arm dry with that. Open up your saline. This is to flush and just make sure that your IV is patent. That's the word that we use, patent, to make sure that it's flowing accurately. Get all the air out. That can kill somebody. So you push this all the way to the top. Let me teach you. This is your adapter piece.
You're scaring.
Why?
That can kill somebody.
Well, if you insert air and then you get the air out of this too. So before you start, you push water, saline through the adapter piece. So when you connect it to her, there's no air that would go through. Let her go ahead and drink her water. The patient wants to get a little hydration in. I always support it. All right, this is the IV catheter, 20 gauge. As you can see, this part is flimsy. This is what stays in her. The needle is gonna come out, okay?
what it looks like. Once you stick the needle in, I always suggest once you see blood flow stop, advance the catheter, and then hit the safety so the needle comes out. All right. I like to hold my needles like this. You okay?
Yeah.
So as you can see, when it blows, you see how it puts that little bump. I have a little discomfort, but it's not worth crying for. So as you can see, it creates this little bubble. That means it's not in the vein. Okay, if it's through the vein, it would just flow straight through. It wouldn't build any pockets or anything like around her skin. Okay, so easy fix. We're just gonna take it out. You're okay. That's what this gauze comes in here for. Use your gauze. Place it right over where you inserted. Pull it out. Just like that. It's done. You just use your tape.
Your vein blows?
People's veins blow all the time. I'm gonna do this one. On a scale of 1 to 10, you tell me how bad did it hurt?
It was probably 7.
You have to stick again because I missed, which like I said is normal. So make sure that when you do take the needle out that you throw it in the sharps container because you don't want somebody to get poked with that. All right, so if my candidate is up for another stick, she does have a good vein right here. This one in her forearm. So I'm gonna try to hit this one instead. Okay, you guys, don't be discouraged. Like sometimes they just slow.
It happens.
Sometimes patients don't let you try again. So it just depends, but you can always just go get somebody else to try, or, you know. I personally think the best time to practice is in the ICU when your patients are like sedated and intubated and they can't feel anything. It's best to just go and practice as many times as you can on those patients. Oh, she keeps All right, let's make sure that this dressing is good. If we do not get this one, I'm literally gonna be mad. All right, you ready? It's gonna be a little poke. 1, 2, 3. So that's in. So now we're gonna flush it. Undo your tourniquet, flush. So now her IV's in, you can advance the catheter. Perfect, and you see she feels no discomfort. The IV is now in.
Yeah,
so
it's definitely better than that.
Then you use your dressing. Oh, crud. Can you pull the back off of this one? Thank you. Use your dressing to lock it down. You just place that right there. Go around. Boom.
I want like this dressing. I haven't seen one like this.
Here. Go ahead and wrap around just like that. Then you can use this extra piece of tape to stabilize it even more. So the last part, this is when you connect your patient to these IV fluids. So the bag that we have over here is still connected to the IV tubing. Forearm, I will go ahead and attach the other content video, but this would be a right forearm 20 gauge IV, and it is patent. So next, since you have flushed it, to ensure patency, you're gonna go ahead and hook up your IV fluids. It's always a great IV when you get blood black flowing into it. Some IVs don't draw back. So then now, in order to get the fluids to go, you're going to slowly undo this clamp like we talked about earlier, and then you'll see the drip chamber start to drip. So this is what we call IV hydration therapy. And now our patient is getting the fluids from the drip chamber, and it is going into her IV. How does it feel?
I feel it. It's really cool.
Yes, it is cold. Does it hurt?
No, it doesn't. It's a big difference from the first one.
Go ahead and get the whole bag. It usually takes about 30 to 45 minutes. And that is the end of our video. Thanks for learning with us.
Thank you.
This is how people's tubing on kind of stuff. So this is how people's tubings be getting messed up. I like to anchor it like this. No, it's okay. I'm gonna show them. You can just put a little piece of tape on the IV. I like top tricks to get air out of your line is to clamp the chamber. So make sure this is clamped. Go ahead and spike this and then undo it, let it go free, and just squeeze the whole bag. All that pressure will get the air bubbles out. Not attached to the patient, of course. and I will see you guys in the next video. All right, you guys, so that wraps up our day of showing you guys some nursing skills of how to start an IV and how to spike a bag of IV fluids. As you can see, it's not always going to be a first time attempt you get it, but you know, you just roll with the punches and always try again. Never be afraid to go for that second try, and don't be in your head thinking that you're not going to get it, because honestly, sometimes they just blow. Like, it probably had nothing to do with you at all. But one thing I will recommend, always bring in double supplies. Like, as y'all can see, I had 2 catheters, 2 IV start kits, 2 adapters. Like, just always make sure you have 2, because more than likely something might happen on the first try. And then if you do try 2 times and you are unable to get it, just always use your resources. Maybe they have a vein finder, or maybe one of your other fellow nurses may be able to support you a little bit better with that. So for right now, that's all the tips and tricks that I have for you guys. If y'all have any questions, please make sure to drop them down in the comment section down below. And if not, I will see you guys in the next video. Bye.